Let's continue with movement of scapula and the muscles attached to it, causing those movements. Upward rotators of the scapula includes upper and lower fibers of trapezius and serratus anterior. So, the upper fibers of trapezius and the lower fibers of trapezius, which have attachment at the spine of scapula as well as the acromion process, will help in upward rotation of scapula. Another one is the serratus anterior. As we saw earlier, that it has attachment over medial border of the scapula, and hence it does upward rotation of the scapula. As we have discussed the similar muscles, origin, insertion and action previously, it's just the continuation. So, downward rotators of the scapula, they are pectoralis minor, levator scapulae and rhomboids. Let's have a look just at the attachment of those muscles over scapula. So, pectoralis minor is attached at coracoid process of the scapula and does downward rotation of the scapula. Next is the levator scapulae, which is also attached to superior angle of the scapula, which is from superior angle to the root of spine of scapula. So it does downward rotation of scapula. And the last is the rhomboids. So rhomboid major and rhomboid minor. So it has attachment over the medial border of scapula and the root of spine of scapula and does downward rotation of scapula. Next we have internal rotators of the scapula, which are pectorals, pectoralis major and minor. So pectoralis major, we saw it arises from medial clavicle plus the sternum and upper 6 ribs and attached to bicipital groove of the humerus. So indirectly, by the action of humerus, as it is involved in shoulder complex, it will help in internal rotation of the scapula. So this way pectoralis major also contributes to internal rotation of scapula. Along with that, pectoralis minor, obviously, which has its attachment over the coracoid process of the scapula, also does internal rotation of scapula. Now external rotation of the scapula, which is done by all three fibers of trapezius, upper, middle and lower, and serratus anterior, as we had already seen. The origin as well as the insertion of the trapezius. Insertion, that is the attachment is over spine of scapula and acromion process, and it contributes in external rotation. And the serratus anterior, again having attachment at the medial border of scapula, doing external rotation of the scapula. Now comes the anterior tilting of the scapula. Here there is one interesting thing. Two muscles which are involved in anterior tilting, pectoralis minor and the other is short head of biceps. Both of them, pectoralis minor as well as the short head of biceps brachii, both of them have attachment at the coracoid process of the scapula. We can see pectoralis minor is also attached to coracoid process of the scapula. Short head of biceps, which is this one, also has its attachment at the tip of the coracoid process of the scapula, and both of them contributes to anterior tilting of the scapula. So anterior tilting of the scapula, this will also help and this will also help. Okay. So that was about anterior tilting. Now the last one will be posterior tilting of the scapula, which is done by lower fibers of trapezius and lower fibers of serratus anterior. So the lower fibers of trapezius till the spinous process of T12, it extends somewhere from T4 to T12 and inserting at again the spine of scapula and the acromion process. So this attachment over the scapula helps it to do posterior tilting of scapula. Another one, again we know that as serratus anterior, it arises from upper 8 or 9 ribs and has insertion over the medial border of the scapula, and it also performs posterior tilting of the scapula.